Hello, I'm Marcus Cheatham from the Mid-Michigan District Health Department. I'm coming to you during a thunderstorm, so there might be some loud bangs. That's fine. Um, I also get occasionally a comment about this thing that's behind my head. It's just a cute little mobile. It's just in a very unfortunate place for making videos, but we have to carry on. Um, People are asking me, Marcus, when is the COVID pandemic going to be over? I want to get back to normal. How long is this going to go? Well, I think of it like running a marathon. There are 26.2 miles in a marathon, and we're about at the end of the first third of the marathon. We're about at mile 8 or 9. The second third, if you will, of the marathon will take us to mile 17, which will be probably January. And according to MDHHS, the Michigan Department of Health and Human Services, that's when the vaccine is going to arrive. And so the third part of the marathon will be getting the vaccine in people's arms, which I'm looking forward to doing. So there is some good news in all of this. The first thing that I'll share is that in mid-Michigan, we have actually had lower numbers and lower rates of COVID and COVID deaths than in a lot of other parts of the state. So as bad as it is, and as awful as some of the situations have been, we have had less issues than a lot of the rest of the state. Our hospitals in our area, for example, didn't get overwhelmed at the peak of the epidemic like they did in some other places. They came close, but they held themselves together. Now, that often makes people ask me, well, then is COVID really a serious killer? Do I need to be worried about it? Maybe we should just go on with our lives and not fight it. And I just want to share this data with you that explains why COVID is a really bad thing. And our state as a whole and our nation have been through some very rough times. This data is from WWMT, a TV station out of Kalamazoo, but it's presenting CDC data that I'm familiar with. And I'm showing you this graph because it's a nice, big, clear graph. It's not a teeny tiny graph out of a science paper. You can really see what's going on here. In Michigan, so far through this epidemic, we have had 6,200 deaths from COVID and 7,500 more deaths than we would have expected. And so you can see here before COVID hit, we're kicking along. Some months we have more deaths than expected. Some months we have less. Some months we have exactly the average. But this is what things normally look like. Then the epidemic hits and we get all these excess deaths peaking out in April at 1,400 deaths on the week of April 11th. Wow. So COVID has really killed a lot of people in this state. And as you know from the descriptions, it is a very bad and painful way to go. Here, interestingly enough, it has trailed off and the deaths have come back down. And that is good news as we look to the second third of our marathon. We might have fewer deaths. This is because we're getting better at taking care of people with COVID. They're learning how to keep people alive. We're getting good at keeping our long-term care facilities, nursing homes safe, keeping COVID out. So our response to the pandemic has improved. So now what I want to do is show you a chart that I made that explains the sort of what's happened with the pandemic in mid-Michigan. We have had 501 cases altogether. This is a graph of the cases by date in our jurisdiction, Clinton, Gratiot, and Montcalm counties. You've got Clinton in blue, Gratiot County in green, Montcalm in red, and then we calculate the average for you in this dotted line here so you can see what that was. And using the color coding, you can really see the history of the epidemic in our area. So it starts out, it's mostly blue. It's in Clinton County. The pandemic in our area started with healthcare heroes out of Sparrow Health System who contracted it, people who worked at Sparrow and lived in Clinton County, and then also people associated with MSU, students and faculty who had traveled abroad and brought it back with them, unfortunately. Then we kind of got things under control by the end of April, and we had another hump. This hump, as you can see, is mostly green. It's mostly Gratiot County. We had a couple of big outbreaks in long-term care facilities that were pretty awful to deal with. But then it died down again in June, and the whole state experienced a lull in June, and now it's come back. And what's happening here? Well, you can see it's all colors. It's blue, it's red, it's green, it's Clinton, it's Gratiot, it's Montcalm. And if you look at the average, the peak right here, this dotted line, and you trace it across, you can actually see that this is the worst it's been in our jurisdiction, unfortunately. And why did this happen? We just had, this is the echo of the 4th of July and Memorial Day weekend. And as you know, people went out and they had birthday parties and graduation parties, and they had family camping in the woods and a lot of churches meeting indoors. And sure enough, when we do our contact tracing, we trace our cases back to events like this where people were careless and made their friends and family sick. So this did not need to happen right here. And that's very unfortunate that these cases happened and these deaths happened and they didn't need to. Some other nice features of this graph, people say, well, you've had 501 cases so far, but how many people are sick right now? Not 501. So this bar across the top right here shows you it's people from this third wave who are the ones who are sick right now, the folks who made their friends and family sick. From people from the earlier waves have recovered. And then the other thing I want to show you is this is the state of Michigan's risk level categories: low, medium, medium high, and high. And unfortunately, you can see if you trace the peak across over here, we're at the high risk level right now. And you know that means as we're contemplating opening schools and restarting sports and things like that, we should not be, because we are actually at high risk. And so that presents a huge dilemma for our schools and other places going forward. So as we look to the future, what do we expect to happen? Is this wave here are we gonna continue to soar up? Are we gonna be Florida and Texas, or are we gonna continue to keep it under control like we've done so far in Michigan? I think that what we're gonna see is continuing humps like this. I don't think we're gonna see a really big second wave in Michigan. And the reason that I say that is because I know that the Michigan Department of Health and Human Services are really determined to keep COVID under control. All of the state agencies are working together to do that. So some of the things that are coming, you're going to see a big media campaign. The polls still show that most people believe COVID is real, they're scared of it, and they want us to continue to work together as a community to keep it under control. And so this media campaign is going to say, yeah, we've got you, we hear you, let's continue to work together and beat this thing. The other thing that's coming is an increase in enforcement, efforts to gain compliance from businesses that right now are being defiant about COVID. You were already seeing, if you've been out there, most of the big box stores are masking up. They've got a big tough guy at the door and they won't let you in unless you wear your mask, and they will escort you out if you take it off. So that's already happening. That was pretty easy for the state. Their lawyers just visited the lawyers at the big box store and gave them an offer they couldn't refuse, and the masks are on. There's still a few who are defiant, like Family Dollar, and I can understand Family Dollar's plight because they had that shooting of a security guard who was trying to enforce the governor's order, and that would obviously make them nervous about their liability, but they will be on board here pretty soon. Will it work its way all the way down to the beautiful little shops and stores in our towns and villages in central and northern Michigan? I don't know. Maybe not. People say, why isn't the sheriff enforcing things? Why isn't the health department enforcing things? We're doing a lot of things that you maybe haven't heard about. They aren't on the news. Um, but obviously a lot people are getting away with a lot of things. Some stores aren't masking, big weddings and things like that are happening at venues that are open that are not supposed to be open. They don't ask our permission. They just do it. There's hundreds of them and there's only one of us, and we're doing the best we can. But the good news is you have a safe place to shop. You can shop at the big box store where they're masking. You don't have to shop at the little store where they're not. And I've got an example from my neighborhood. In our neighborhood, there's a nice little True Value hardware store, very close to our house. And there's a Home Depot some distance away. And we always tried to shop at the True Value hardware store to support, our local business and jobs for kids in our neighborhood. And now we are driving past the True Value hardware store to go to the Home Depot, because the True Value, unfortunately, they're COVID deniers. They think it's all just a big pandemic. And so it's not safe for us to go there. And all of us can exercise safer choices, and we need to be doing that. We should be doing that. We need to keep the numbers down. We need to keep the numbers down so our schools can reopen. And we have on the Mid-Michigan District Health Department website a really nice illustration of why that is, a video of our medical director, Dr. Morse, talking to principals, superintendents, and other school personnel about their plans for reopening. And if you look at the last quarter of that thing, Dr. Morse is sharing a PowerPoint, and then she takes it down, and you can see people's faces, and you can see the stress on the faces of these school personnel as they try to think about how can we safely reopen schools. We've got kids' lives in our hands, their parents' lives in our hands, our staff's lives in our hands, and COVID is still out there. It's still spreading, and the families of our kids are doing reckless things. They have a huge dilemma. So we need to do all that we can to support them. People ask me a lot, how can we do that? It's so complicated. I don't understand what we need to be doing. It is very simple. Stay home if you can. If you have to go out or go to work, wear a mask, socially distance, and wash your hands. It's that simple. So let's talk about the last third of the marathon. When the vaccine comes in January, look, my team's already burnt out. The people I work with, I respect them and care about them so much. They're already tired. I can't imagine how tired and burnt out they're going to be in January. But I want to tell you one thing. All of us in public health want to get to January. We want to run the last third of the marathon and get that vaccine in you. And the reason we want to do that is, we want to get the magic sword, Excalibur, and kill the COVID dragon. And we want to do it for you, so you can have peace of mind again. You can feel safe. You can be with the people you love again. So that's it for the Mid-Michigan District Health Department. More news when we have it. Thank you very much for caring about health.